Hi everyone, my name is Adrian Quevedo, founder of Newrologix, and I'm here with Michelle Adams, founder of Pediatric Therapy Solutions in Sarasota, Florida, and we're going to talk about neurofeedback, all of the amazing things that it does, and get to know Michelle and her practice a little bit, and share this video with as many people as we can to try to, get some information out there about neurofeedback. And so, Michelle, I'm gonna just hand it over to you, do a little intro on yourself and about your practice, and we'll kind of just go into talking about neurofeedback.
Sure. I own Pediatric Therapy Solutions, like Adrian said, here in Sarasota, Florida. We are a private clinic that offers occupational therapy, speech and language therapy, as well as ABA therapy. We do offer neurofeedback sessions and brain mapping to our clients and to our community.
Cool. So basically, a lot of people ask, what is neurofeedback? How does it work? And so we're going to kind of dive into it a little bit. And as we're going through this, we'll probably, break up the conversation into the different segments. So initially, the first thing that we do in order to get a brain map done is we do a brain map recording. And so the way that the brain maps work is we essentially take a cap, and the cap has sensors built into it. And what we do is we pretty much just place a cap on the head, and every head size is different. So we have different size caps. And once the cap is on, we just secure it. Once it's on, then we literally take a little bit of prepping gel, and the gel kind of just goes into the cap. So it's just cold and kind of slimy. Kids tend to, think it's kind of funny. But we get the cap on, we put some ear clips on to be able to kind of get what we call noise cancellation. So the ear clips and the cap go on, the gel goes in, and then once we have all that set up, then we go ahead and place the person in a comfortable chair, and we hook them up to a 19-channel amplifier. This amplifier is pretty sophisticated. It's pretty much similar to the ones that are used in hospital systems, and they listen to brain waves. And the brain waves are the tiny little impulses that come through the scalp. And as we're connecting and taking all that information, we get this image of the brain. And the way that we look at the brain is by taking all of the signals and putting them together into what we call a digital output. So this is essentially what the brain waves look like. The brain fires anywhere between 0.4 to 30 times in a second in different areas and regions. And so the collection of the brain waves gives us the ability to take all that information and triangulate it and create a full image of the brain from inside out, which is really neat because ultimately, a lot of the conditions and things that we see in clinics and offices are things that are based in the brain. And so the example we're going to use for today is for a brain that has had a diagnosis, or the person's had a diagnosis of ADD. And what you're seeing here essentially is the brain in all the different frequencies at once. And so what we'll do is we'll actually pause this here and we'll take a look. So this is essentially the top of the head. So you can kind of see the nose there. And this is rolling over to the back of the head. So we're going to go to the front. In that front part of the brain there, that's the executive control, decision-making areas of the brain, the parts that control attention. They control decision-making, impulsivity. And whenever you have too much of a slow frequency, which is what this red indicates, that red indicates that there's too much power in that frequency. And when we have that, we get this image, and this image represents that the person definitely has too much of this theta frequency, which can cause more of those symptoms that are related to attention deficit and concentration and difficulties. So I'm going to cut over to a brain map report, and this is the report that we get from the brain map. And I'll let Michelle kind of discuss a little bit about the features that are involved with the brain map, and kind of cover those and give examples of how these are things that we see in office.
Okay, so when a client comes in to receive their brain map, Adrian comes and does that service directly for us. And based on those brain mapping results, that creates a document for us to then form a treatment specialized individually to your own child's unique needs. This is a brain map summary form. We as clinicians receive the full form, which can be 13 to 15 pages of data. This summary form is a few pages that basically summarizes what Adrian has found through the data accumulated on that brain map. It's divided up into cognitive efficiency, which you can see has attention, verbal processing, decision-making, visual processing, motivation, comprehension, math, and memory. To the left there is basically an average, if you will, or a summary of the normal or typical findings versus abnormal or imbalanced areas in the brain, the different lobes and different waves that were treated. So what you can see on this individual brain map is some difficulty with the frontal lobe, that F3 findings, as well as occipital lobe, the O1 and O2, and temporal T6.
So tell me a little bit about like when you have families come in and they, they're looking for help or they're looking for assistance. Do these things typically pop up, or are these things that you normally see with your clients? Things like attention, verbal processing, reading
100%, 100%. The biggest things that we see, obviously, at the clinic have to do with frontal lobe functioning and executive functioning. When children are referred to us, typically it's because there's a breakdown occurring. So they're going to be referred to us by a teacher or by someone else in the community that's working with them, and that child is just having difficulty achieving a next set of skill sets, and they don't know why. So they come to us maybe for speech and language services, for occupational services or ABA services. Also regarding visual motor control, visual perceptual control. So the beauty is, from a brain map, we can break that down and say, is it perception? Is it visual processing? Is it auditory processing? Or is it truly frontal lobe dysfunction, executive functioning? So for us, we can do our standardized testing and motorically, or from a speech and language expressive receptive language standpoint, try to get a full picture. But what we love about neurofeedback is it kind of completes that whole child perspective and gives us what's truly going on in the brain, what's going on in those lobes, what's firing, what's not, and kind of pinpoints for us and gives us some of that missing data that we can't get from a face-to-face evaluation.
Yeah, and that's a perfect tie-in to then the things that parents at home see, because in addition to the cognitive function that we see on the brain map report, we get this emotional profile that really takes an overall look at the ability to focus, your mood, and your relaxation capacities, and then breaks it up into pretty easy to understand terminology with focus. So for example, focus, the characteristics that involve focus are things like impulsivity, socially inappropriate. We get a lot of questions about that one, because it's not really saying that your child is acting inappropriately in a social capacity. What it's saying is that sometimes you have a child that can be the wallflower that really doesn't love attention, and then you got the child that just loves the attention all the time. We never really know the difference, but these characteristics and these things also tie into cognitive function, because imagine, being a child in a classroom environment that can't concentrate, can't focus. It's pretty normal, to be down on yourself and have things like excessive self-concern and self-deprecation, being hard and critical of yourself, and be angry and be irritable and be passive aggressive, because you're having challenges in a classroom environment. Those things also translate over to social aspects as well too. So are these things that you typically see, or things that parents talk about as far as kids having trouble, not just with classroom environments, but with social interaction and just, family dynamics as well too?
Of course. And, it doesn't have to be necessarily a medical diagnosis, but there is aspects of sensory integration, sensory processing disorder, and how that affects self-regulation, how that affects attention, how that affects social skills, family peer interaction, 1000%. And that's what is so great about the brain map, is it breaks it down. Is it focus? Is it mood? Is it relaxation related? And then those subcategories just dive into it that much further to say, oh, actually, you're right. My child doesn't do this, but they do this. And now we can see that that is the case, and how can we help, and how can we regulate these waves to create a more, optimal presentation in our child. And in turn, those things will affect their focus and their mood, which is all in all just a positive thing.
Yeah, no, absolutely. And it always amazes me that we get this worry marker sometimes, and it's amazing how when we find kids that are dealing with stressful environments and situations in a classroom, they worry a lot. And if you look,
Yes.
these markers independently of themselves, they're designed to look at specific brain networks and how they integrate and work together. But all these things are tied into one giant network, which is the brain. And so if you have a child that is dealing with social issues and interpersonal relationships with other people in classroom environments, siblings, even parent interaction, and you got a child that has, imagine having this anger, being critical of yourself, having that irritability, being impulsive, and then also having worry. This poor child just has so many different things that they're having to deal with on a day-to-day basis. And one of the, I guess, most revealing and telling things that we get when we do these brain map reports is parents seem to have like this wave of just emotion that comes over them because they've known all these things for so long, but no one has really ever like extrapolated and pulled back, the layers of the onion far enough to give them answers as to why, like, these are things that they're not making up in their head. My child worries all, my child's anger, my child, says all these negative self-defeating behaviors, and here it's presented in a report that gives them the ability to then say, now how do we address this? And I think, we'll get into what the neurofeedback is and how it works in a second, but one of the other amazing things too that we get from this report is we've tied it into the University of Maryland, who has a really large database on supplementation. So I'll let Michelle talk a little bit about how integrating supplements and just nutraceuticals into the diet can be beneficial as well.
Well, just like you stated, we're looking at our kids, especially in this day and age, and there is so much, mood, anxiety, depression, all these things that do affect our cognitive functioning. And if you look at the top part of that summary, that cognitive efficacy and how they complete their daily skills in their classroom setting, and that's where the breakdown ends up occurring. But we really do need to try to help and support that structure and that foundation. And that, to me, those foundational skills are those processing, that mood, all of that. And to kind of add to that and make that more of a stable foundation so that their cognitive efficiency can be in a most optimal position, we have to look at their daily needs. We look at their sleep, look at their exercise, look at their diet, and where that's lacking. I think that that's the beautiful part about this, is that we can tack on some supplements and some, biochemistry and say, okay, where are the holes in the foundation? Can we help and fill them that way so we can support their nervous system and support their brain, support their gut and in addition to and on top of neurofeedback to really get the biggest bang for your buck and really have some nice results from that.
So I think one of the other really neat things that we get from the report is, we get these answers, and then initially everyone's first question is, well, that's all great and dandy, but what is it that we can do then about, correcting this? How do we correct it? And what are the things that neurofeedback can do in order to, to get everything back in line? And that's exactly where we start, with the neurofeedback. So the neurofeedback itself, easiest way to describe it is basically your child or your child are going to end up enjoying this a lot, because what we end up doing is we put you in front of a computer screen and we let you watch a movie, and that movie, as it's happening, the screen fluctuates. So we're going to jump a little bit into kind of how the neurofeedback process actually works, so people kind of have an idea that it's not, we're not shocking anybody. This isn't shock therapy. This is basically just biofeedback for the brain. So what we did is we put together a little video that has all, kind of how the process goes. So essentially, when you come in, what we'll do is we'll take a cap, and the cap is kind of like an elastic cap that has holes placed into it. And those holes are designed to basically place the sensor in the correct place every single time. And we mark it with a dry erase marker. And once we mark it, we clean the areas of the scalp with a little bit of alcohol and a prepping gel. And then we use these sensors. Instead of using the whole cap, we're only looking at a couple areas of the brain when we're doing the neurofeedback. So there's no need to do all the goo and the gel every single time. And a lot of people are grateful for that. So once the cap is on, essentially it's placed in the same exact spot every single time to ensure accuracy and making sure that we're putting the sensors in the correct place every single time. And once the cap is fitted, everything is marked with the dry erase marker. And the dry erase marker is pretty essential because it doesn't leave anything behind once we clean it with the alcohol swab. It makes a nice clean mark and then puts it in the same exact spot every single time. And then once the cap is used and the areas are marked and the cap comes off and it's not on your head, and then we part the hair, use the alcohol swab with a little bit of prepping gel, and we clean the location. The reason we clean it, pretty simple. We just want to make sure that there's no oil or dirt in the way that's going to impede the signal. And once the paste is on the sensor, we place it on the head. It's kind of like would you describe it as kind of like a little waxy consistency, Michelle?
Yes, yes, exactly.
Yeah, so once it's on the locations, again, we mark them, clean them, put them on. Then what we do is we place the electrodes on the other side. The neat thing about how the Newrologix system works is that we train the brain left and right sides independently of each other. And I'm going to explain why that's important. When you're training the brain, each left hemisphere, or the left hemisphere of the brain and the right hemisphere of the brain, actually are very independent from each other. There's a small connection between the left and right hemispheres called the corpus callosum, and that area of the brain connects the two hemispheres to give it, dialogue between left and right sides. So by training the left and right side, we give the brain the ability to then exercise the correct brain waves for the left side, but then also train the right side its own independent value. So that way we're making sure that we're creating balance. So once the sensors are placed and we're hooked up, then we're running. As the provider or as your technician is running the session, we're monitoring the brain waves from the laptop, and the laptop is connected to a monitor. And the monitoring of the brain waves is essential because we need to see whether or not we're getting the changes that we want, the shifts happening in the right appropriate time. We adjust reward values, and then once all that's set up, you're sitting and you're watching a movie. And as that movie is being displayed, you are essentially watching and making sure that as you're watching the show and everything is playing out, that you're focused and you're concentrated. And if all that's being done correctly, then you get to watch the movie. And as long as that's happening, and as long as we're doing all that, the movie will continue to play, the brightness will stay up nice and high, and that gives us the ability to then, go over the results on a regular basis and kind of track the progress. So after each session, what we do is we basically pull up a report that Michelle and I will kind of go over and discuss on a regular basis. We'll even discuss progress and do the review sessions through graphs and charts. And as we're kind of tracking and monitoring that progress, we have the ability to make those changes. So Michelle, I'm going to let you talk a little bit about the experience at the office with the kids and any feedback that you've gotten from parents about the experience, and whether or not you've had kids that hate doing this or not, or whether they love doing it.
Okay, so we do have a portion of the office especially and specifically set up for neurofeedback, and you come in with your child, and just like Adrian said, we will place the sensors appropriately. We have a really comfortable environment. It is a rarity that a child is unable to accept those sensors. There is an opportunity for that child to sit on that parent's lap with some form of layer of material in between so that conductivity doesn't overflow or overlap if need be. But typically we've only had a small percentage of children that need that kind of support. Kids like movies and kids like shows, so they love the fact that they can sit down, they can turn on their favorite show or movie on Netflix, and while they're starting to watch that, we do our magic. So we're putting on the sensors, we're hooking them up, we're getting everything aligned, and then we switch over that dampening screen creating, like you said, that dim or dull effect if there is imbalance. And then once that brain learns the technique and learns what it's supposed to be doing, then that child gets that positive reinforcement or that reward. If you think about operant conditioning, that they get that positive clarity, which they can see their favorite show or movie with in a brighter light. So if the brain then goes back to a disorganized state, then that screen will go back to dampening. So it's really cool to see. We see the most effect after our 10th visit, 10th session. I would say that 8 to 10 is when we start to really see some change happening. And then typical session load goes upwards of 30 sessions. And within that time, that's when we really see the most change. I would say some of the greatest results that we have seen is actually a lot with language acquisition. We tend to see those floodgates open for our traditional therapies to really set in and take place and produce a jump forward, if you will, in our goal sets. I find that neurofeedback really does come and help organize and create a more homeostatic state in the brain for us to come in and hone in on, our OT and speech and behavior skill sets. And it creates a really nice playing field for us, if you will.
Yeah, and that's pretty much across the board what we get with most offices that decide to take on neurofeedback as a service. So I think that we've kind of covered the basics. I would say that in the coming weeks or so, I think it would be fantastic to maybe get some feedback from parents about this video and see if there's any particular areas of interest that they have. So a lot of things we talk about obviously are the cognitive efficiency pieces with attention, verbal processing, decision making. We could spend hours talking about all these different areas of the brain and what they do. So what I love to do is like I said, get some feedback and see if people have any interest in talking a little bit more in depth about their child or a condition that they might want to get some information about. And then you and I will just have a conversation, chat about it and record it. And maybe it'll get somebody some information. So other than that, I think that, easiest thing from here, I think would be just to, how do people find you? How do people get information about Newrologix? So let's get website and phone numbers out there, and then.
Of course, I'd love to. Our office is located again in Sarasota, Florida, and our number to the direct front office is 941-360-0200. On the web, you can find us at pediatrictherapysolution.com, and that's singular, solution.com, and we have a specific neurofeedback link. And if you go there, you'll find all the information you need regarding our specific office, as well as Adrian's office, Newrologix in Orlando as well. So you can get a really nice background on what to expect, what we offer, what's included in our service packages, as well as research and data options, which I think are really important.
Yeah, so I think that that was awesome. I really enjoyed this. So we'll catch up again. We'll go talk a little bit offline here and see what other creative topics we can discuss about neurofeedback and your clients, and then we'll pick it up again next time. So it was great talking to you, great seeing you again, and I'm happy to be a part of this, so I appreciate the time.
Sounds great. Thanks, Adrian. Appreciate it.
All right.